Healthcare organizations face a critical data challenge. Legacy and expensive BI platforms like Crystal Reports, SSRS, and Tableau are slowing down clinical decisions and operational efficiency. These tools force teams to wait days for patient insights that doctors need immediately. Even worse, most of these platforms lack the AI capabilities needed for predictive analytics and advanced insights. The problem runs deeper than just slow reporting. Your data infrastructure is fragmented across Azure warehouses, ETL pipelines, and disconnected systems. Clinical data doesn't talk to financial systems. Patient outcomes get siloed. HIPAA compliance becomes a manual nightmare. The cost? Delayed care decisions, missed population health trends, compliance risks that could trigger federal audits. The solution is strategic migration to the Microsoft ecosystem. Consolidate reporting into Microsoft Power BI. One platform, real-time dashboards, embedded security. Unify your data infrastructure on Microsoft Fabric. Clinical data, operational metrics, financial systems, all connected in a single analytics platform. The result? Faster clinical insights, proactive patient monitoring, optimized operations, and complete data visibility. But traditional migrations take 12 to 18 months and often fail. Kanerika's Flip Migration Accelerators change that. Crystal Reports to Microsoft Power BI, SSRS to Microsoft Power BI, Tableau to Microsoft Power BI, Legacy Azure to Microsoft Fabric, Informatica to Microsoft Fabric, pre-built frameworks, automated conversion tools, healthcare-specific templates. We compress 12 to 18-month projects into 8 to 12 weeks. 75% less manual effort, 50% lower costs, 60% lesser resources. Ready to accelerate your migration? Let's talk.